was actually born at home. All but a couple were born at home of the 8 of us, and so I kind of had an old-fashioned upbringing, started working when I was young, in my young teen years on the farm. So when I was 15, I was in a car accident driving home from, actually I was riding home from school. A friend of mine at the time was driving, and unfortunately we were in an accident. I was taken to the ER, and I remember Dr. Lee was the ER doctor, was his name, made a very lasting impression. And he called me that night and just made sure I was okay. And I just got to thinking about it. I'm just, like, well, this could really be something for me. And then I ended up finding that there was this rural medicine program in Rockford, and it seemed like it was made for me. So I ended up, going to undergrad and looked at that and said, this would be perfect for exactly what I want to do. So that's what I did. And what makes the most sense for a small town is a family doctor, because family physicians are trained to do so much that one person can impact thousands versus being a specialist that maybe does one organ system, right? So that was kind of where that came to be, and I actually loved everything in medical school that I did. And so instead of being, a specialist in one area, I decided to do everything because I loved everything. I pride myself on being very thorough and taking a lot of time with patients, and so I think that the philosophy comes down to listening to the patient at the core of what's really going on, and then doing a really thorough physical exam to find out what's going on as well there, and then ordering some tests that are appropriate. I think patients would describe me as someone who likes to take their time as much as they can, be very thorough, and really give a good explanation for the why, and also figuring out the why of the condition and not just treating the symptoms, to figure out truly what's at the core of it.